Look, I'm going to be completely honest with you here because this is something that's been eating at me for months now. I've been practicing medicine for over 20 years, and I can't tell you how many men I've seen walk into my office looking absolutely defeated because they're getting up 3, 4, sometimes 5 times a night to pee. And you know what the worst part is? Most of them think it's just getting old. They've resigned themselves to it like it's some inevitable part of life. But here's what really gets me fired up, and I mean really pisses me off, is that in probably 70% of these cases, it's not aging that's destroying their prostate. It's stuff they're doing every single day that they have no idea is slowly, silently making everything worse. I'm talking about habits that seem completely innocent, things their doctors never even mention. Just last week, I had this guy come in, Harold. He's 73, and he's telling me he can't sleep through the night anymore. He's exhausted, his wife's exhausted because he's constantly getting up. And I'm looking at this man who used to be this vibrant, active guy, and now he looks like he's aged 10 years in the past too. So I start asking him about his daily routine, and within 5 minutes I'm thinking, oh my God, you're doing everything wrong. And that's when it hit me. We doctors, we're great at treating the problem after it shows up, but we're terrible at helping guys understand what's causing it in the first place. It's like we're waiting for the house to catch fire before we mention that maybe leaving the stove on all day isn't such a great idea. So here's what I want to talk about, and I promise you this isn't some scare tactic or me trying to sell you something. This is me being brutally honest about what I see every single day in my practice. There are habits, and I'm talking about simple, everyday stuff, that are enlarging your prostate right now, and you probably don't even know it. The thing that really opened my eyes was when I started tracking my patients' daily habits instead of just looking at their symptoms. I mean, we're trained to focus on the medical stuff, right? But when I started asking about their morning routine, what they drink, how they sit, what they eat for lunch, that's when patterns started jumping out at me. And the number one thing that shocked me, and I mean this literally kept me up at night when I first realized it, is how stress is absolutely destroying men's prostates. I'm not talking about the obvious stress, like losing a job or dealing with a sick family member. I'm talking about the low-level, constant worry that most guys carry around every day. The financial stuff, the health concerns, the family drama that never seems to end. Your body doesn't know the difference between being chased by a bear and worrying about your retirement savings for the 3rd time today. It pumps out the same stress hormones, and those hormones, they're like gasoline on a fire when it comes to prostate inflammation. I had this wake-up call about 6 months ago. I'm examining this patient, and his prostate is so enlarged I'm thinking we're looking at surgery. But something felt off to me, so instead of immediately talking about procedures, I spent an extra 20 minutes just talking to him about his life. Turns out, he'd been caring for his wife who has dementia for 3 years. 3 years of constant stress, barely sleeping, never taking a break. I convinced him to try some stress management techniques first, nothing fancy, just some breathing exercises, and getting his brother to help out a few hours a week so he could actually rest. 6 months later, his symptoms improved more than I've seen with some medications. His prostate was still enlarged, but the inflammation had gone down significantly, and he was sleeping through the night again. That's when I realized I'd been approaching this all wrong. We keep treating the prostate like it exists in isolation, but it doesn't. It's connected to everything. Your stress levels, what you drink, how much you move, even how often you hold your pee because you're too busy or too far from a bathroom. And speaking of holding your pee, God, this drives me crazy because it seems so harmless. But when you regularly hold urine, your bladder stretches and pushes down on your prostate. Do this for years, and you're creating constant pressure and irritation. It's like having someone squeeze your arm all day, every day. Eventually, it's going to swell up. Then there's the sitting thing. Look, I get it. You've worked hard your whole life. You want to relax in your recliner, watch your shows. But sitting for hours without moving is cutting off blood flow to your pelvic area. Your prostate needs good circulation to stay healthy, And when you're parked in that chair for 3 hours straight, you're basically choking it. I learned this the hard way myself, actually. I spend a lot of time at my desk, and a few years ago I started having some urinary urgency issues. Nothing major, but enough to make me think, this is interesting. Started setting a timer to get up every 30 minutes. Just walk around for a minute or two. Problem solved. Sometimes the simplest solutions are the most effective. But here's what really gets me worked up, the dehydration thing. Seniors reduce their water intake because they don't want to pee more, especially at night. But this creates a vicious cycle. When you're dehydrated, your urine becomes concentrated and irritating. This irritates your bladder, which puts pressure on your prostate, which makes you feel like you need to pee more urgently when you do go. So you drink even less water, making everything worse. I tell my patients all the time, your body is like a river. If the water stops flowing, things start to get swampy and infected. Keep it flowing clean and clear, and everything works better. And don't even get me started on the coffee thing. I love coffee, don't get me wrong. But I see guys drinking 4, 5 cups a day, wondering why they're running to the bathroom every hour. Caffeine doesn't just make you pee more, it actually tightens the muscles around your bladder neck, making it harder to empty completely. So you're not just going more often, you're not emptying fully, which leaves stagnant urine sitting there, irritating everything. The food stuff is trickier because nobody wants to hear that their favorite meals might be causing problems. But I've seen it over and over. Guys who love their spicy food, their processed meats, their fast food convenience. Their prostates are paying the price. It's not that you can never have these things, but when it's every day, when it's the foundation of your diet, the inflammation builds up. What gives me hope, though, is seeing how quickly things can turn around when guys make even small changes. I'm not talking about completely overhauling your life overnight. I'm talking about drinking a glass of water when you wake up, standing up during commercial breaks, switching to decaf after your first cup of coffee, taking 5 minutes to do some deep breathing when you feel that familiar stress building up. The truth is, your prostate wants to be healthy. Your body has incredible healing capacity, even at 70, 80 years old. But you have to stop doing the things that are working against it every single day. It's like trying to heal a cut while you keep picking at the scab. It's never going to get better until you stop making it worse. What really motivates me is thinking about guys like Harold, who went from being miserable and exhausted to getting full nights of sleep again. Or my patient Frank, who thought he was looking at surgery, but after changing just 3 habits, his symptoms improved so much that we've put surgery on the back burner indefinitely. Your prostate doesn't have to control your life. You don't have to accept constant bathroom trips, interrupted sleep, and the anxiety that comes with wondering if it's going to get worse. But you do have to be honest about what you're doing every day that might be making things harder than they need to be. Look, I'm going to be completely honest